So what we want to do is cultivate a capacity for kindness. So, close your eyes. Take a few moments to breathe in and breathe out. So what we want to do is cultivate a capacity for kindness. So, close your eyes. Take a few moments to breathe in and breathe out. So what we want to do is cultivate cultivate a capacity for kindness. So, close your eyes. Alrighty, chat, let's get started. Hope y'all had a happy Thanksgiving week if y'all are celebrating Thanksgiving. I had some fun. I did a little bit of camping, which is fun to do at this time of year. So it's nice to be back. I feel rested, rejuvenated. Happy Monday, everybody. And welcome to another Healthy Gamer GG stream. So my name is Alok Kanoja. Just a reminder that although I'm a psychiatrist, nothing we discuss on stream today is intended to be taken as medical advice. Everything is for educational or entertainment purposes only. And if y'all have a concern or question, please go see a licensed professional. Yeah, so how's everybody doing today? Y'all doing good? I missed y'all too. It's actually really nice to be back. Sometimes when you are away from work for a while, you're like, oh man, I don't want to go back. But I actually feel like it's nice to be back. It's good. Pretty rough. What's going on? Exhausted? People having a rough Monday? What's going on with people? Some people are feeling great. Exhausted because of therapy. Okay, well, that's hopefully going to be will be worth it over time. Too much work. Sleep deprived. Wallet's a little slim. Yeah, man. Life is hard, chat. Not going to lie. It can be really hard. I'm lucky in that way. I think I have a lot to be grateful for. But yeah, I mean, I'm a little bit on the tired side myself today, but that's for other reasons. But it is worth it, but I'm also scared of therapy. Yeah, I feel you, chat. I can feel my own energy level sinking a little bit just hearing this, which is okay. So one of the things that I wanted to talk to y'all about, so we've decided actually officially to drop the Right in the Fields DLC. So this event has been so helpful to people that we decided to actually continue it. So our DLC, I think, is live. So this is our Right in the Fields event. You can sort of, sign up anytime. And what we've got here are our core things, which are like emotion trackers. So this is where you start off with. Reflecting on your previous entries. We've talked a little bit about how people have found that quite helpful. And then we sort of started with empathy labs, and now we've got self-exploration and emotion regulation. So here's the emotion regulation thing. So you can sort of talk a little bit about, okay, so here's our emotions wheel. So let's do, I guess I can't type happy, interesting. We can type content. So we've got this next, and then we can sort of inhale, hold, exhale, hold, inhale, hold. So this includes Kumbhak and Rechak, which are sort of breathing in and breathing, or holding your breath with a full breath of air, with a lung full of air, or holding your breath with a completely empty set of air. So you can do emotion regulation. And then now that hopefully for those of y'all that have been participating and doing all these other things, we can sort of start to direct our emotional understanding towards towards self-exploration. So one of the things that a lot of people, we're going to be talking a little bit about this today. So people are sort of struggling sometimes, or burdened by the identities that they carry with them. So for example, I'm a gifted kid. That's a classic one from our community. And I was talking to someone recently who was a woman who was sort of struggling with all the identities that women are kind of I wouldn't say forced to carry, but a lot of times there's sort of this like tension between like what does it mean to be a good woman. I think men are sort of struggling with this kind of stuff too. I just happen to be talking to someone who is a woman and sort of talking about being a mother versus not a mother, deciding to have children, not to have children. So as we sort of start to realize that we carry these identities with us, they can be quite burdensome. And how do you sort of let go of some of those identities? It starts by becoming aware of what you carry with you. There's also an alexithymia quiz. So if y'all are interested in learning more about your emotions and sort of building up that EQ, check out Right in the Feels. Okay. So I don't know. I think we're going to be running it for maybe 2 or 3 more weeks. I'm not quite sure. It is free to do. So our community events are generally speaking free. Right. So we've got different kinds of stuff. I think for people who are just interested in like learning and education, we have stuff like Stream and our YouTube channel and things like that. For people who are interested in a little bit more longitudinal, comprehensive, or deeper learning, we have Dr. K's Guide. For people who are interested in some amount of focused skills building, that's what our community events are for. So I want to do more than watch a YouTube video, but I don't want to commit to something like coaching. That's why we have these events. And then and then last but certainly not least is coaching, which is when people are really interested in working with someone to make a dedicated and focused change in their life. So I always thought I was good with my EQ, but nope. Well, so like you may be good, but there's usually room to grow, right? Just because you calibrate at a high rank doesn't mean that you can't climb. Yeah. So today we've got a couple things coming up. So y'all can decide what we want to do if mods are around. So I was thinking about talking about 2 things today. One is brain fog, and the second is comparison. So starting to understand a little bit about how we compare, why we compare, and what to do about it, and also digging into brain fog. What do y'all want to start with? What do y'all think? Let's see. Oh no, 50-50. Not again. Okay, looks like people want to talk about brain fog. Let's do it. Yeah, brain fog is the clear winner, so we'll talk a little bit about brain fog. Okay. Let's just give people a chance for the poll to finish. And I may need to draw things out. So we're going to go into like legit teaching mode for this one, okay? Because this is a little bit more medical of a topic. Can we compare brain fogs? Increasing. Okay. So let's all right. So let's talk a little bit about brain fog. So I think brain fog is an increasingly important thing to discuss because it seems to be like rapidly rising. So we know that, for example, 19 out of 20 people on the planet now have basically had COVID. We also know that about 10% of people, or up to about 10%, the number's probably closer to 7 or 8% of people who have COVID have brain fog. But we also know that brain fog seems to be increasing like across the board. And the reason that this is such a big problem is because brain fog is one of the worst things to have for a couple of reasons. The first is that if you have brain fog and you go see a medical professional, chances are they'll like punt you somewhere, like they'll tell you to go see a therapist, or they won't really give you any sort of constructive help, right? So if you go to a doctor and you say, well, like I've got, my brain doesn't seem to be working quite right. Well, first of all, like what does that even mean? And then the doctor may order some kinds of tests, right? They may sort of check to see if you have an infection. They may sort of check your blood counts. They may check a couple of things. But at the end of the day, brain fog really isn't a diagnosable condition. And it also appears to not really be a treatable condition. So a lot of times what happens when people struggle with brain fog, which by the way can be like incredibly debilitating. So when we talk about brain fog, what we're sort of talking about is like difficulties with concentration, difficulties with short and long-term memory, usually more short-term memory. So people are incredibly forgetful. People tend to find that they require a lot more effort to do like basic cognitive tasks. So studying is harder, work is harder. It just seems to be kind of like incredibly debilitating without sort of having any kind of like, smoking gun in terms of what's causing it. So oftentimes we sort of accept that like, okay, yeah, like if I've got the flu or COVID, that's the reason it's hard for me to work. But the problem with brain fog is that it tends to persist for very long periods of time, doesn't have a clear cause. And then even if we go seek help from medical professionals, oftentimes they'll order some tests or maybe evaluate us, but then they don't really have any sort of like treatment or anything significant they can do to help us, which is exactly why it's so frustrating. The other thing that tends to be kind of unfortunate in a lot of ways is that a lot of times if you go see a medical doctor and they can't find something wrong with you, but you are still struggling, and the ways in which you are struggling are not testable, right? So this isn't something like I've got wheezing in my chest, or my blood pressure is very high, or my heart rate, I've got an arrhythmia, I have a rash or something like that. If it's something like cognitive, what usually medical doctors will do is if they can't sort of find something very specific, what they're going to do is send you to a mental health professional. They'll refer you to a psychiatrist, because if we can't find what's wrong with your body, it sort of must be in your head. Or the best doctors will still sort of acknowledge that it's psychosomatic, which we'll get to in a minute, but they'll sort of send you to a mental health professional. And then the problem kind of becomes, okay, so let's say I go see a therapist, whereas like I don't know if you guys know this, but as you train to become a therapist, you get a total of 0 hours of training in how to deal with brain fog, right? It's like, it's not a DSM diagnosis, so it's not like a psychiatric illness, which is what people are trained in. We're trained in stuff like trauma and anxiety and depression, but brain fog really isn't something that we're taught about. And so then the problem is that the answer that you're kind of given is mental health help, which can be helpful in some ways. But then the other problem is that as we learn, as we'll sort of discover today, brain fog actually is not a psychiatric illness. There's a lot of strong evidence that it is actually physiologic in nature and neurologic in nature. So the solutions that people with brain fog are being given are ones that are actually like not very useful, like scientifically. So let's kind of tunnel down into this and understand a little bit more about what brain fog is and what we can do about it. So the good news is that we do have a lot of research recently into sort of what causes brain fog, or what are some of the culprits. And the neat thing about that is as we discover what the mechanisms of brain fog are, we'll also naturally start to discover what are some potential solutions. So let's kind of dive into this, okay? Okay. Let's take a look. So now what we're going to do is take a quick look at some of what we know about brain fog, okay? So the first issue with brain fog is that we seem to know that it's increasing. Oh, wrong color, okay. So brain fog, first of all, appears to be increasing. So as we kind of tunnel down into this, people, as brain fog has been sort of on the rise, and as people have been sort of getting COVID, what we've discovered is that like the interest in brain fog is increasing, the research in brain fog is increasing, and there are a couple of key things that we've learned. The first is that brain fog seems to be associated with inflammation, and specifically mast cell inflammation, okay? Now, this is important for a couple of reasons. The first is that if things are inflammatory in nature, first of all, we sort of can kind of infer that they're not psychiatric in nature, or that gets a little bit complicated, but there seems to be a physiologic cause, and specifically the target seems to be mast cells. So there's a lot of evidence that shows that mast cells are actually correlated with the extent of brain fog. And what we sort of have discovered is that brain fog appears to be like inflammation, specifically within our central nervous system or brain. So I don't know if you guys have sort of felt that, like, if you get the flu or COVID or some kind of infection and you have this whole body inflammation, or if you have something like lupus, what you're going to experience is some amount of cognitive impairment, right? You don't feel quite as energetic. It's hard to study. It's hard to focus. Your short-term memory will be negatively impacted. And so we sort of know that inflammation can cause these problems. And we also know from lots of research that mast cells seem to be implicated. The other thing that's kind of interesting is that this inflammation also seems to be associated with obesity. Now, I know that there's a lot of tension on the internet nowadays around fat phobia and things like that. I'm not trying to be fat phobic or place value judgments on people who are overweight. But what we do know, this is something that a lot of people don't realize, is that adipocytes, or fat storage cells in our body, are not just storage. They're actually endocrinologically active and immunologically active. So what that means is that the number of adipocytes, or the size of adipocytes that we have in our body, correlates with a certain amount of inflammatory activity, or correlates with some amount of endocrine activity. So we know that these are not just benign storage parts of our body, they're actually physiologically active and can actually lead to inflammation. Okay? And we also know that obesity is actually correlated with brain fog. A couple of other things that we sort of have discovered is that when it comes to the mast cells, the mast cells are actually either on themselves or right next to the mast cells. We have these things called CRH receptors. And CRH is essentially a stress, it's not a stress hormone itself, but it's a signal that causes the release of a stress hormone. So what we sort of know is that here we've got our CRH receptor, and let's say here's a mast cell. And so when CRH comes in over here, it activates the mast cell. The key thing here is that if we say, okay, inflammation is one of the causes of brain fog, and it's mediated through the mast cell, what triggers the mast cell? Well, it seems that stress, specifically CRH, is one of the key things that induces mast cell activation, which then in turn leads to brain fog symptoms. Okay? And you may say, well, like, what's the point of all this, all right? Like, I don't understand why we're learning this science. Well, the reason we're learning the science is because hopefully as we start to understand the mechanisms, this will also open the path to understanding how we can sort of combat brain fog. Okay? The next thing that's kind of really interesting is that brain fog is also associated with a condition called POTS. So POTS is postural orthostatic hypotension syndrome, which is essentially a condition that has to do with low blood pressure. Specifically, that is postural in nature. So if you want to get kind of a quick understanding of what it feels like to have POTS, if you are laying down in bed and you jump upright out of bed, first of all, don't do this if you've got blood pressure problems because you could fall over. But if you jump right up, what you'll sometimes notice is that if you stand up suddenly, you'll start to get a little bit of dizziness. And what was responsible for the dizziness is that as we stand up, the blood flow to our brain actually decreases. And it takes a few seconds for our heart and our vasculature to kind of adjust to the effect of gravity. Because remember that when we're laying down, right, so we're not really fighting against gravity. But when we stand up, now our heart and blood vessels actually have to pump blood this way to sort of get to to increase cerebral perfusion, or to get blood flow to our brain. So some of y'all may have experienced that if you stand up suddenly, you'll feel dizzy for a second or two, and then your body essentially compensates. What happens in people with POTS is that their ability to compensate is somehow impaired. So when they stand up or sit up, they tend to have low blood pressure, which impacts their cerebral blood flow. The key thing here is that we know that brain fog is associated with low cerebral perfusion, which is a fancy way of saying we know that people with brain fog actually have less blood going to their brain. Okay? So it requires more blood flow to complete particular cognitive tasks. So the other way to kind of think about it is if you've got one person with brain fog and one person without brain fog, the amount of blood that this person needs to complete a memory task is higher versus the amount of blood that this person needs is relatively lower. So people with brain fog, there seems to be something around cerebral perfusion as a cause of brain fog. Another thing that's really interesting is that as people have sort of looked at certain chemical compounds, and they've essentially found that flavonoids, and specifically something called luteolin, seems to reduce inflammation, has a neuroprotective effect, and appears to improve brain fog. Okay? Now we got to talk about flavonoids and luteolin for a second. So something has been happening recently with our diet. So we know that, for example, people are eating more processed foods, which is a part of the problem. But one of the reasons why I think that brain fog is actually getting a lot worse is because of the way in which our food is actually grown. So over the last, let's say, 20 to 50 years, we've started to use a lot of fertilizers, and I'm not like anti-GMO or anything like that, but we have selected for vegetables, and so flavonoids are oftentimes found from green leafy vegetables. So the rate at which vegetables are being grown is actually increasing. So it used to take, let's say, like 6 months to grow a crop of spinach, and now we've really accelerated their growth rate using certain kinds of genetic modifications and fertilizers. And the result of that is that, sure, it grows really quickly, but the nutrient density is actually decreasing. So we know that with some kinds of food specifically, so in some ways the nutrient density is exactly the same that it used to be, but in other kinds, there are some kinds of nutrients which the faster you grow the plant, the less the plant kind of absorbs particular things or is able to create particular things. And so what we're actually finding is that there's a correlation between rapid growth of a plant is inversely correlated with its nutrient density. And this is something that I sort of discovered kind of in an interesting way. So I went hiking last year in Alaska and I found some wild raspberries. And the wild raspberries were like really, really small. They're like nowhere near the size of like the raspberry that you get, at a grocery store. And so we were picking wild raspberries and eating them, and like they were super sour. Like they didn't taste, they didn't look as beautiful. They sort of like tasted like incredibly sour, but there was something oddly delicious about the wild raspberries that when I went back and like got my supermarket raspberries, like sure, they were big and they were juicy and they were sweet, but there was something that I could almost like tell a difference between like the nutrient density between the wild raspberry and the one that I could get at the supermarket. So there is some evidence that as, we're sort of having more and more rapidly growing foods, that there's a correlation with sort of a decrease in nutrient density. And this becomes really, really important because when it comes to absorption, we only absorb about 10% of flavonoids from our diet. So what that means is that our body is very, very inefficient at absorbing some of these compounds, which in turn means that if we're reducing the nutrient density from our foods, it makes it like sort of like, since our absorption is so low, if we kind of cut the nutrient density in half, we're ending up with a lot less of these compounds in our diet. And then as a result, we're sort of having less of this inflammatory protective effect and neuroprotective effect. A couple of other things that we've sort of found that are associated with brain fog are poor sleep. So about 90% of people with brain fog will report having poor sleep or insufficient sleep. And then the last thing that's kind of interesting is that we also know that dehydration appears to be correlated with brain fog as well. And in one study, 88% of people who had brain fog qualified or reported some degree of dehydration. So this is kind of interesting, right? Because now we're starting to see that, first of all, and I want to show you all one other thing just directly from a paper. There's also some evidence that, just to kind of, the last thing is, what about things like depression? So there's actually some studies that have specifically examined psychiatric comorbidities and brain fog. And what they've actually found is that psychiatric comorbidities are not associated with the cognitive impairment of brain fog, at least in certain inflammatory conditions. This is a paper about chronic fatigue syndrome. So we know that brain fog that's sort of caused by these like sort of mysterious inflammatory conditions appear to be not psychiatric in nature, which is really, really important. And I think this is actually what's really unfortunate, is because like a lot of times doctors will send people to mental health professionals to deal with brain fog because they sort of don't know what else to do. And if we can't figure out what's wrong with you, let's send you to a therapist because they'll be able to sort it out. But as we take a look at this, what we actually find is that there's a lot of physiologic sources of brain fog. Okay? So now let's take a look at these 6 things and try to understand a little bit about, okay, like if these are the causes of brain fog, and that's, we're not quite there yet. So this is just some evidence that implicates these are some of the mechanisms. What does that tell us about why brain fog is getting worse? Now that we sort of know these are the things that are involved with brain fog, what's going on in our society with all these things? The first thing is that obesity is on the rise. Okay, so what we're going to do is just take a quick look at these and very simply try to figure out, is this getting worse in society or not? Is obesity getting worse? Absolutely. Is general inflammation getting worse? Absolutely. Is stress getting worse? Absolutely. Now, here's an interesting one. What about blood pressure, right? Is blood pressure on the whole getting worse? And what we actually discover is that as we are getting to a more and more sedentary lifestyle, what we're starting to do is have a deconditioned cardiovascular system. So if I'm sitting in this computer chair all day, right, and I'm not like exercising or anything like that, if I'm not physically active, what I've actually seen an alarming amount of is young people that have like blood pressure problems. So I'm talking about 20-year-olds, 25-year-olds that will have symptomatic dizziness when they stand up from their computer chair because they've been sitting in the computer chair all day. And so we're seeing that this kind of stuff, this sedentary lifestyle, is actually getting worse as well. The other thing that we sort of mentioned already is that there's, let's say, vague, non-conclusive, but strongly suggestive data that our diet as a whole is getting worse. And this isn't just about processed foods. This is also about the lack of nutrient density in a lot of our fruits and vegetables. Is sleep getting worse? Absolutely, right? So as technology usage gets worse, we've got issues with blue light, impaired melatonin production, low quality sleep, right? Not to mention all these other things like lack of physical exercise and stress and stuff like that, that sleep on the whole is getting worse. And what about dehydration? Are we as a whole getting dehydrated? And this is one where I'd say, like, I'm not really too sure. So we do know, for example, that in one study specifically on POTS, that 88% of people are associated, or who have brain fog, also will sort of endorse some degree of dehydration. And this is also important from a blood pressure standpoint, because proper hydration is one of the most important ways to keep our blood pressure up. Specifically, when someone has been in like a car accident or something like that, to keep blood going to people's brain, what we'll sort of do is use two wide bore IVs to pump in saline or blood products into people. So one of the ways that we maintain blood pressure in the brain is by actually like injecting people with saline, right? So we sort of like give them bunches and bunches of fluid. And as we increase their fluid, it maintains their cerebral perfusion. So what we're sort of seeing in society today is I think we're seeing an increase in caffeine intake, which is dehydrating. And this is especially a problem for people with brain fog, because what we sort of found is that some people will treat brain fog with things like stimulants, but what I've really found is that a lot of people who are struggling to focus, what are they going to do? They're going to drink coffee, right? So we see that brain fog is oftentimes associated with a higher level of caffeine intake. And generally speaking, a lot of our diet has become unhealthy and people may not be drinking enough water. It kind of depends on who you are, where you are. But one of the things that I've definitely seen with brain fog is an increase in caffeine intake that's almost compensatory, that can result in some amount of dehydration. And as we get dehydrated, what we're actually doing is potentially making our blood pressure worse. Okay? So now the question becomes, all right, so if this is like what's associated with brain fog, like the quick question is, okay, what do I do about it, right? And this is where the sort of frustrating thing, sometimes when you go to a medical professional and they don't know what's wrong with you, is they'll tell you to just be healthier, right? They'll say, okay, if you've got brain fog, like, why don't you just do the diet and exercise, right? Just exercise more, diet more, spend less time on your screen, just get better sleep. We're kind of given these like general like ideas about, you know, like what you should do to get healthy. Like those are just the generally healthy things to do. And it can be quite devastating because a lot of people will have brain fog and they'll go to doctors and they'll go to therapists and people aren't really able to help them much. The good news, this is good or bad news depending on how you look at it, is that a lot of times, you know, when people have brain fog, they actually end up in my office because, you know, so prior to doing this whole healthy gamer thing, my primary area of interest was actually evidence-based complementary and alternative medicine. So I was focused a lot on sort of scientifically valid meditation techniques, yoga techniques, herbs, things like that. So I had a clinic where people would refer their patients to me who were interested in like more natural remedies. And so what I sort of found as a clinician is that, give me a second. So what I sort of found as a clinician is that when people would get referred to me a lot, right? So what would happen is like some doctor would be like, okay, oh yeah, like this person is complaining of these vague stuff. Like let's send them to Dr. Kanoja because Dr. Kanoja handles these people well. So there's a psychiatrist. This person has something wrong with their head, right? So let's send them to a psychiatrist. So they would come to me. And the thing is, I'm a psychiatrist, right? So I'm a psychiatrist. So I'm trained in evaluating people for mental illness. And as these people come to my office and I kind of evaluate them and they've got this vague like brain fog sort of stuff, what I sort of quickly conclude is that I don't think this person has mental illness. I don't think this person is like ill in their mind. I don't think they have anxiety. I don't think this is depression. This isn't bipolar disorder. It's not like their mood is very bad kind of is the root cause. Oftentimes what we'll see in brain fog is that their mood is bad, but that's secondary to being unable to do things. So it's hard for me to study. It's hard for me to work. I'm not doing as well. I'm not progressing. My energy levels are low. I can't think. I can't concentrate. That's what causes the low mood. It's not like the low mood comes first. It's a consequence of. So then I'm kind of stuck in this situation where these people are coming to me for help. And it's like, I'm kind of the last stop, right? On the train to nowhere, let's say. And so I'm sort of trying to figure out, okay, how am I going to help these people? And the good news is that actually, like, I've had really good success. I can think of maybe one or two patients. And if you're watching this, I'm still sorry about not being able to help you substantially. But for the most part, I'd say about 80 to 90% of the people that I've worked with who have brain fog, I've actually been able to help pretty substantially. And it wasn't like I therapized them. What we actually found is that by targeting all of these different dimensions, it can be actually, you can sort of figure out a good plan to sort of improve your brain fog. So a couple of other things. So another medical disclaimer that this is something that what I'm going to share with y'all now is stuff that I have found useful in my clinical practice. I myself used some of these interventions. So I had pretty bad COVID about a year ago and was also noticing some amount of brain fog. So I kind of went through my own brain fog regimen, and I found that I basically am completely recovered from that. But remember that this is not medical advice and that each and every one of you should really talk to a doctor about all of these things and sort of try to figure out a customized plan. But here are a couple of things that work. The first is yoga or Tai Chi. And specifically, I found Shirshasana to be very effective. So Shirshasana is a headstand pose. So it's this particular asana where you're upside down, right? So it's a yoga posture where you're upside down. It's definitely something that requires some degree of training. So I wouldn't try that at home. You really need a good teacher to teach you how to do it. But Shirshasana is literally like you're just doing a headstand, right? So your head is at the bottom and your feet are at the top. And the cool thing about Shirshasana is that it really trains your body to maintain blood pressure to your brain. So it really wreaks havoc on your cerebrovascular system and your vascular system, not in a negative way, but it sort of trains you to be upside down. And as you're upside down, it trains your body a little bit to handle blood flow a little bit better. So Shirshasana or any kind of yoga or Tai Chi, I think will probably be effective. There's also good evidence that yoga and Tai Chi have anti-inflammatory and stress-reducing effects. So I'd recommend yoga or Tai Chi. Specifically, probably slightly more recommend yoga over Tai Chi. And that too, some of the yoga postures that you should do are ones that have postural changes. So bending down and touching your toes, doing the hand above your head, maybe doing something like downward dog or Parvatasana or things like that. But yoga is actually really good at having your body move in particular ways that require you to maintain blood pressure. So yoga or Tai Chi is number one. Second thing that we have to consider is obesity. So this is where some amount of exercise is actually really important, but we're going to tunnel down into what kind of exercise. So it's not just reducing obesity for its own sake, although we do know that adipocytes are pro-inflammatory, right? So we talked a little bit about that. But specifically, the kind of exercise that we want to do is going to be cardiovascular in nature and ideally has you using your legs. And why is that? So there are a couple of really important things to understand about sedentary lifestyle and the impact of sedentary lifestyle on specifically our leg muscles. So our heart is here, okay? And our heart pumps things. And generally speaking, our blood tends to pool at the bottom of our feet, right? Because of the effect of gravity. So there's one really interesting thing. If you look at your body, what you'll sort of find is that even if you look at the back of your hand, okay, it's kind of out of focus. But if you look at the back of your hand, you can see veins, right? Even if you look at your head or your neck, you can see veins. So veins tend to be pretty peripheral when it comes to the top half of your body. But if you look at your legs, it can be very hard to see your veins. And the reason for that is because a lot of times our major veins in the legs are actually on the inside of the leg. And we actually rely on our skeletal muscle, the muscles in our legs, to pump blood back to the heart. So anytime I walk, what the contraction of the skeletal muscle, anytime I take a step, is actually helping blood come back to the heart. So one of the things that I found is that with a sedentary lifestyle, we're walking less. As we're walking less, we're getting more blood kind of pooling in our lower extremities. So we're seeing increases in stuff like varicose veins and stuff like that. And all of that is associated with a sedentary lifestyle. So any kind of exercise specifically that involves walking and a high level of cardiovascular like workout is actually really good. So this is one of the situations where, I wouldn't recommend specifically like bench pressing. So bench pressing will increase your cardiovascular weight, but like getting gigantic muscles on your arms is not actually, or your chest is not actually what we're really shooting for here. What we really want to do is engage that skeletal muscle in our legs and ideally start to exercise and get to a decent heart rate, right? So essentially cardiovascular activity using the legs is what we want to target. So that'll also have the added effect of hopefully reducing our obesity and a couple of other things. The next thing that we want to do is really think a little bit about our diet. So remember that there's actually studies that show that, let me just show you all a quick paper. Okay. So studies that show that there are some compounds. So brain fog, inflammation, and obesity, key aspects of neuropsychiatric disorders improved by luteolin. So we know that some of these flavonoid compounds, specifically something called luteolin, which I think is extracted from usually olives. And this is potentially another reason why the Mediterranean diet has like positive anti-inflammatory effects, is because of the prevalence of olive oil. So you may have luteolin in the Mediterranean diet at a high level as well. So people can also supplement with luteolin, but this is definitely something that I would encourage you to talk to your doctors about, because luteolin can be biologically active with other compounds like medications and things like that. But we sort of know that supplementing with flavonoids and luteolin can actually have a positive effect on brain fog. So the other simple way to kind of think about this, though, is that if you eat nutrient-dense greens, that'll also do the trick. So it's not just healthy diet in general. It's sort of thinking a little bit about, okay, what are the dietary inputs that I need to kind of compensate for the brain fog? And the specific thing about luteolin and flavonoids is that they seem to have very positive effects on the parts of our brain that appear to be affected by brain fog. So remember this mast cell activation, this high level of inflammation. There's very strong anti-inflammatory, antioxidation, and neuroprotective effects of flavonoids and luteolin. So that's something that I would definitely recommend that y'all talk to your doctor about. The last thing to generally consider is to remember like two super basic things. The first is sleep and caffeine. So sleep is incredibly important. So just about every person that I've worked with brain fog has needed to have some kind of improvement in their sleep. So if you're not sleeping properly, sleep is just the general time that our brain uses to heal itself, right? So if we're like not sleeping properly, or our sleep is disturbed, or we have too many substances on board, if we use marijuana to help us sleep, if we use alcohol to help us sleep, even if we take exogenous melatonin, I'm sometimes a little bit concerned about the high level of exogenous melatonin use, even though from a medical standpoint, it's very, very safe. But I think good sleep is huge for brain fog. The last thing to consider is, once again, hydration. So this is where you just got to be drinking lots and lots and lots of fluid. So if we're talking about this blood pressure effect, we got to remember that like fluid intake is very, very important for maintaining a healthy blood pressure. So you've got to really look at what's your liquid intake over the day. Are you drinking lots of soda? Are you drinking lots of caffeine? Are you drinking enough water? How often are you urinating? What is the color of your urine? You generally want to be urinating like a light yellow color. If your urine is completely clear, your fluid intake may actually be too high. If your urine is very concentrated, or you're not urinating very frequently, there's a decent chance that you're not drinking enough. So these are the last kind of two things to consider. So it's unfortunate that brain fog has been really like expanding very rapidly. I almost get the sense that there's like a silent epidemic of brain fog that's happening in our society today. And the most devastating thing about that is that as it's affecting more and more people, the solutions that we're offering people with brain fog don't seem to be working very well. So if you go see a medical professional, it's a good thing to do, by the way, because they can rule out other causes, right? So if it's something like anemia or vitamin B deficiency, there are a lot of things that can kind of contribute to brain fog-like symptoms. The downside is that if it's true brain fog, then chances are it's not one of those vitamin deficiencies. And you should rule all those things out. But then your doctor is sort of left at like, kind of like, I don't know what to do. And then sometimes what they'll end up doing is just referring you to a therapist or just telling you like, oh, eat healthy and exercise, which is actually part of the solution. Don't get me wrong. But then the other problem is that once you get referred to a therapist may be able to help you in some ways. But the real problem is that brain fog is not a psychiatric condition. It's actually a physiologic and neurologic condition. And so oftentimes what our medical system actually does is sends people to the wrong professionals. And then when therapy or psychiatry kind of doesn't work for you, then you're sort of left feeling like, okay, well, I've tried everything. Whereas it turns out that you started with the worst thing, right? Because it's not a mental illness. And then people feel really, really hopeless. Then you kind of come back to your doctor and you say, hey, the therapy isn't working. And then they're kind of like shrug their shoulders and we don't really know what to do. So my hope today was to share with y'all a little bit about, what are the mechanisms of brain fog? What are we starting to understand about it? And some of the stuff that I found to be somewhat useful for some of my patients, as well as for myself in terms of my own post-COVID recovery. Remember that your mileage may vary and that this is absolutely a situation where you want to talk to a medical professional first to get evaluated for all kinds of these other things, right? And if you do that, hopefully what we'll start to see is that your brain fog will actually get better. And I would say that like 80 to 90% of the people that I've worked with brain fog, with some combination of the stuff that we just talked about, will actually get better. So hopefully that helps you. Questions? Harvard psychiatrist, Dr. Chris Palmer. I know Chris. Chris is great. So Chris is fantastic. So Chris Palmer was on, he was on Huberman, and suggests that keto diet may help with brain fog from a mitochondrial perspective. So Chris has done a ton of research on ketogenic diet. He's done a lot of work also on like epilepsy and stuff like that. So we know that ketogenic diet is healthy for a lot of conditions. I think that, so the main mechanism of the ketogenic diet is actually probably, or not the main, but a main mechanism is the reduction in carbohydrate intake. And a lot of our carbs are actually pro-inflammatory. So I'm not surprised at all that ketogenic diet would be useful for brain fog, because we know that ketogenic diet is useful for reducing inflammation and can be protective against things like epilepsy, right? So when it comes to CNS health, ketogenic diet seems to like correlate with that. There's also a lot of good evidence that a lot of fermented foods can help with all kinds of inflammatory conditions and like be good for you. So we know, for example, there's studies that show that kimchi is actually protective against ulcers. Yogurt is actually really good for a lot of different stuff. I haven't looked at research specifically on sauerkraut, but we do know that a lot of these fermented foods, probably part of the reason that we have them in our diet is because from an evolutionary perspective, the cultures that started to include fermented products actually found a survival benefit. So it makes a lot of sense. Can clinical depression cause brain fog? I would say yes and no. So I would say that clinical depression can cause symptoms similar to brain fog, but the mechanism of action behind those symptoms and what we call brain fog can be different. So we do know, for example, that it looks very similar, right? So that you can have difficulties with concentration, difficulties with memory, difficulties with attentional control, stuff like that. But it appears that the mechanism of action may be a little bit distinct. And the reason that we kind of know that is because we've seen brain fog directly after discrete physiologic and infectious challenges, right? So post-COVID, a lot of people will have brain fog. I don't think that everyone post-COVID is suddenly developing major depressive disorder. So that's why it's important to kind of rule out major depressive disorder. But that's part of the reason why people get referred to psychiatrists, is because it kind of like looks like depression, right? Difficulty concentrating, low energy, like brain isn't quite working right. And then it's further confounded by the fact that people who have brain fog can develop some degree of what I would call an adjustment disorder. So this is sort of like a depression that is the consequence of the brain fog. It's like, oh crap, now I'm living a life with brain fog and I can't quite do things the way that I'm supposed to. And that makes me depressed. Yogurt can absolutely be helpful. Yeah. So brain fog tends to be characterized by difficulties concentrating, difficulties with memory, literally just the perception of fogginess in the brain. So like my brain, like it feels like my thoughts are not clear. So I have to like reach further. Like it's like harder to like reach and like grab thoughts. Thoughts tend to slip away a little bit easier. It's almost like your mental activity is moving through like molasses instead of air. So microglia are also implicated in brain fog. So some of the inflammatory stuff that we're talking about is mediated through microglia. But I think there's stronger evidence for mast cells as a culprit. Can you talk about the brain fog relation to COVID and how to improve it if you were otherwise healthy? So, I mean, that was basically the whole talk. So COVID is one of the causes for these CNS, long-term CNS inflammations is what we're thinking now. And there are some, we're not entirely sure how to fix it. But what I've sort of found as a clinician is when I work with people who have brain fog, like a combination of some of this stuff seems to help them a lot. So specifically cardiovascular exercise, improving sleep, making sure your water intake is really, really adequate, reducing your caffeine intake, which can compensate for the symptoms of brain fog, but result in dehydration, and specifically doing yoga and Shirshasana, it really helped me a lot. How do you distinguish between, I saw something about, I see someone started making sourdough bread and their brain fog got better. That's cool. How do we distinguish from brain fog from depression or burnout? So that's where like I really think a clinician is really important. I mean, we can sort of go through, let me think about whether I want to. Okay, we can do that. Let's talk about. Okay, let's see if we can do that. How can we distinguish? So the question is, how do we distinguish between burnout, depression, and brain fog? So let's give this a shot, all right? I'm going to try to do a kind of a back of the napkin sort of approach to this. So we've got brain fog, depression, and burnout. So the right answer to this question is you should go see a clinician, because this is like literally what our job is, right? This is the problem with things like WebMD, is that WebMD, like you can search for something, right? And WebMD will pop up and you'll be like, oh, I have all those things. But a differential diagnosis, being able to differentiate between stuff, is actually where real clinical reasoning comes in. So let's start with looking at a couple of things about the differences between these things. So the first thing about, let's call this major depressive disorder, actually. Okay. Or let's call it mood disorder. Let's start with the mechanism, or sorry, the origin of the problem. So with a brain fog, it's usually some kind of inflammatory condition. Okay. So this is something like an infection, or a autoimmune condition, but there's some kind of inflammation. That's the root of the problem. So other contributors to inflammation include obesity, because remember, adipocytes are not just storage cells. They're actually inflammatory. They're immunologically active. And then we can also get like a lot of other things with brain fog, like so chronic fatigue syndrome, fibromyalgia, things like lupus cause brain fog, Cancer causes brain fog. So there's some kind of inflammatory condition. That's the cause. So in a mood disorder, we're not really sure what the cause is, but it's primarily psychiatric, not inflammatory. So there have even been some studies that show that depression is correlated with inflammation in the brain. But the really interesting thing is that treating inflammation does not always improve depression. So people were really excited because when we discovered that depression may have, or major depressive disorder may have an inflammatory component, people were like, this is great. Let's give people ibuprofen and other anti-inflammatory drugs. Seems like they don't really help very much. Okay? Now, the origin of burnout is, I would say, not even psychiatric. This is a work or like a work individual conflict or a stressor individual conflict. So what this sort of means is that if you look at both of these are both endogenous. They essentially come from within you. It's something that's going on within you. Whereas burnout is a relational cause. So it's about something about you interacting with the outside thing. So whereas brain fog and mood disorders will persist even if you change your environment, burnout will actually improve or should improve with an environmental change. Okay? So let's now move on to so this is, let's say, causes. Next thing let's look at the course. So here's another thing that we look at as medical professionals. So let's start with depression. So the course is episodic. So with major depressive disorder, what we see is periods of time where people feel depressed and then they get better. Even if you don't treat them at all, they'll still get better if it's a true mood disorder. Now, there are other, this is where things get complicated, whereas if someone says, I'm depressed, that may not be a mood disorder. That could be a personality disorder or something that's more chronic. But generally speaking, when you look at things like bipolar disorder or major depressive disorder, they're characterized by episodes. So we're talking 2 weeks to 1 year, and then it tends to get better. Okay? So it comes and goes is another way to put it. So with brain fog, this tends to be more persistent. So it doesn't come and go. It's usually incited by a particular event and then will persist. Now, it may wax and wane depending on the underlying condition. But can change with underlying condition. So what does this mean? This means that if my brain fog is caused by lupus and I treat the underlying condition, then the brain fog will improve. But it's essentially like brain fog tends to persist. That's what's so friggin' debilitating about it, as long as the inflammation is persisting. So especially in the case of like long COVID, like sometimes brain fog will or usually I think brain fog does get better over time, but it tends to be slow. And then what we sort of know about burnout is that it can improve with environmental change. Or it can also improve with the way that you relate to your environment. Change in relation to environment. So people may say, wait, hold on a second. What does that mean, Dr. K? This means that if my burnout is caused by a boss who expects too much of me, I can do two things. I can change the boss, so I can find a different boss, right? Or what I can do is learn how to set better boundaries with my boss. But the course of burnout can change a lot depending on your environment. The course of mood disorder or depression is episodic, and the course of brain fog is frequently persistent as long as the underlying condition is there. Okay? Let's see. In what other ways can we kind of compare and contrast? So a couple of other things that, let me just think about this because I'm kind of making this up as I go. So what are some of the other things? Okay, we can start with this. Yeah, we've already talked about causes. So let's talk a little bit about manifestations. So let's start with depression. So depression tends to be characterized by the acronym SIG-ECAPS. Okay, so sleep, interest, guilt, energy, concentration, appetite, psychomotor changes, and suicidality. So if you look at this, like some of these things are consistent elsewhere. So if you look at, for example, brain fog, what we're primarily looking at is changes in concentration, attention, memory, energy, oftentimes due to the underlying cause. But you usually don't see things like changes in appetite or changes in, let's say, anhedonia. So anhedonia is the the inability to gain pleasure from activities that you usually find enjoyable. So anhedonia is pretty specific to depression. You usually don't see things like suicidality in brain fog, unless it gets very, very severe. The other thing about brain fog is you'll oftentimes have physical, inflammatory symptoms. So you'll have either you'll have pain somewhere or so with chronic fatigue syndrome, fibromyalgia, things like that, you'll oftentimes have some other associated physical symptoms that correlate with the underlying inflammatory cause. So this stuff is going to cause other things, which you wouldn't see in the case of depression. And the last thing with burnout is that, so burnout is really characterized, first of all, by a loss of empathy, a feeling of tiredness, not really anhedonia. In fact, the opposite. So in burnout, people love doing what they love doing. The whole problem with burnout is that all I want to do is the stuff that I want to do. I don't want to work at all, right? My energy levels are super low. The other thing that tends to happen with burnout is we have less negative self-attitude, although you can have this. So this is where we're talking about guilt in depression. So a lot of times people in depression have something called negative self-attitude. And this is characterized by things like shame or guilt. I basically think I'm not worth very much. And that's kind of what leads to this sense of suicidality. So sometimes when people are severely depressed, they'll think that the world will be better off without them. Whereas in burnout, you don't really see that, right? Sometimes with burnout, you'll get some degree of imposter syndrome or some degree of low self-worth. But generally speaking, you don't see things like suicidality. And you don't see anhedonia and you don't see suicidality. You don't see a very, very bad negative self-attitude. It's just hard to describe. It's just a little bit different. So, but I'd say loss of empathy is huge with burnout. So if you want to understand the difference between these three, this is just I haven't prepped for this talk at all. This is just based on my clinical experience. The three seem very similar in a lot of ways. But the truth is that they're actually quite different. And the whole point of seeing a clinician is so that they can help you tease apart, because there are a lot of overlapping symptoms, right? There's lack of energy, there's difficulty concentrating, not wanting to work or having difficulty working. So those can be really common amongst all three, but it's really important to tease apart, okay, what is the cause of this? What is the course of this? And what does it kind of manifest as? Does that answer your question? Good question, actually. Where do you get your nutrient-dense leafy greens? What a great question. So a great place to get nutrient-dense leafy greens is to grow them. So I don't know if you guys have noticed this, but if you grow some fruit or vegetable yourself, it always tastes, or even if it doesn't always taste great, but there's something about it that feels more satisfying and nutritious than something that you buy from a store. I don't know what DPDR is. Did that answer y'all's question? Did that make sense about differences between brain fog, burnout, and depression? Oh, depersonalization and derealization. Those are kind of completely different, man. They're like on a completely different axis. So you can get depersonalization and derealization are. Let me think about how to explain this. So I'd say depersonalization and derealization are effects, not causes, usually. So depersonalization and derealization are like adaptations that our brain or body will do in response to particular stresses or triggers. That's generally speaking how I look at it. They're like states of mind or states of consciousness. They're states, not causes. Someone saying, sometimes I binge technology for 30 minutes to an hour and I tend to feel brain and fatigue. How can I recover in that state quickest? Close your eyes for like 10 to 15 minutes and lay on your left. Lay down on your left side. You can try doing something like meditation if you want, but I'd say just close your eyes and lay down on your left. So FR Los is saying, can you help me? I have not a single clear identifiable emotion except for greed and disgust. Something horrible is happening inside of me and I don't know why. I would strongly recommend you see a mental health professional if that's your situation. Right? So why left? That's an answer for a different day. Just try it and you let me know if it's more effective than on your right. Growing microgreens? Interesting. Yeah, I'm not sure exactly. I'd be curious about that. Answer for a different day, chat. It's not that I'm like trying to not answer it. It's just that the answer is not simple. So in order to answer it, I would need to explain a lot of different things. It's not a tease. It's just, you know, I tried to answer questions more specifically. Like we did a whole second little thing there. Okay, so someone's saying, so I have brain fog right now from only sleeping 3 hours. Should I get some nutrition dense food? So I'd say if you've only slept 3 hours, right? So simple things being simple, like this is what we're saying is that generally speaking, if you want to take care of yourself in general, right? So this is not specific to you. If you want specific advice to you, you should really go see a medical professional and get evaluated for everything. But the short answer is if you're only sleeping 3 hours a night, then you should probably start by sleeping more, which is probably what they're going to tell you. Yeah, as chat will tell you, maybe sleep more. Okay. Shall we move on? What do y'all think? Shall we? By the way, what are y'all playing nowadays? Anything good to play? Factorio, Terraria, Dota, Slay the Spire. Oh, yeah, someone on our subreddit posted about Monster Train. Dude, I picked that up. That was epic. Monster Train is great. I also started playing Legend of Heroes recently. That's also pretty hype, too. Oh, is there an update for Valheim? Don't buy the expansion for Monster Train. Too late. Valheim, the Valheim update, but did the actual game get released? Wait, hold on a second. Did Valheim was released? Still early access, right? Yeah, okay. So I'm going to play Valheim again when the game actually comes out. There's a weird high-pitched hum. It's probably my microphone is quite sensitive, and it may be my fan. I got a new video card recently, so we're going to be playing some games at some point on stream. Okay, give me just 1 second, and then let's move on. All right. Okay, we're going to talk about comparison in a second, okay? Give me 1 second, chat. Y'all can take a bathroom break if you want. We'll start in a minute. Nutrient-rich games. Okay. Put too much hoisin sauce on my phone. First world problems. Anyone? How many languages do I speak? 我可以说一点中文。ちょっと日本語話します。olvido mucho español, pero hablo un poquito español. थोड़ा गुजराती बोलूं. Chale. Can't be a true weeb without a little bit of Nihongo, am I right? Okay. Should we talk a little bit about comparison? You can't watch anime without learning some Japanese, dude. All right. Okay. So today we're going to talk a little bit about comparison. And I hear this a lot. We're talking about this because I hear a lot of people will sort of say that comparison is the thief of joy. And I'm noticing that more and more people nowadays are like comparing themselves a lot. And it almost seems like an epidemic. Like there's something almost addictive about comparison, right? Like you're kind of going throughout your day and you kind of see that someone else is doing something and you're like, oh, why can't I do that? Or you're on the internet and you're browsing /r/I am very smart on Reddit. And you see a lot of people who will compare themselves to other people. So we see that there's a lot of comparison. And a lot of times, the more that we compare ourselves, the worse we feel about ourselves. And then the issue is that as we kind of look at like science and mental health professionals and like wellness blogs and stuff like that, what people will say is that, oh, if you want to compare yourself less, spend less time on social media, right? We have all this research that shows us that, spending time on Facebook or spending time on Instagram or social media or whatever, like worsens our mood. And so that our solution should be just like spend less time on the internet. And that's actually like, that doesn't really work, right? So you can tell people to spend less time on the internet, but it's really hard to do. Like, I think that the challenge right now is that if you find yourself making a lot of comparisons, telling you that the solution is to spend less time on the internet is an effective solution, but it's actually really hard to implement. So what I'd love to do today is to talk to y'all a little bit about, first of all, why comparison feels so damn addictive. Secondly, to try to understand, hold on a second, why do we compare in the first place? And once we understand why the brain has evolved the capacity to compare and what comparison does, then we'll gain some insight into it and try to understand a little bit about how to compare less. So let's start by understanding a little bit about why we compare in the first place. So we all know that our brain has the capacity of comparison. In fact, that plagues us, right? Because anytime I'm kind of doing something, if I'm not careful, my brain will make a comparison. If I go to the gym, I'll make a comparison to someone else at the gym who works out more than I do, and my success now suddenly becomes a failure. So we know that we compare a lot of the time. The other thing that we also know is that oftentimes we will compare ourselves to other people as well that are below us. So we compare to people above us and compare to people below us. And sometimes we find ourselves making comparisons like I'm so smart or I'm so great or that person is not nearly as good at League of Legends as I am, or whatever. We'll make different kinds of comparisons. They're noobs and I'm an expert. The reason that I'm stuck at this rank is because I'm surrounded by noobs, but it's not like I'm bad. I'm the only one who actually knows how to play the game properly. I'm stuck in the trench, right? It's a curse of being in the trench, and there's nothing I can do about it. So we make a lot of comparisons. And it turns out that there's actually like a really interesting theory from psychology called social comparison theory that actually looks into why we make comparisons. And social comparison theory basically says we make two kinds of comparisons, and they each serve a different purpose. The first is something called an upward comparison. So this is when we sort of like look at someone who's better than us in some way, and we make some kind of comparison. Now, when we look at upward comparisons, they actually have a very, very important function. The reason we do it is because it helps us in some way. And generally speaking, when we make an upward comparison, the advantage of that is we get an opportunity to think about what we could be doing better to mimic that to improve our own lives. So when we make an upward comparison, we say, okay, this person is more in shape than I am. Maybe I need to start doing a little bit more of what they're doing. Or if I get a B+ on a test, or if I get an 85 and someone else in the class gets a 90, then I can start to think a little bit about, well, this person is better at studying than I am. What can I do to get a 90 next time? So one of the reasons that we make comparisons is to sort of look at people who are doing a little bit better than us so that we can learn techniques to improve our own life. The second reason we make comparisons is something called a downward comparison. So this is when I think of myself as really awesome, and I pick someone who's below me to make a comparison. And if you look at that, essentially what's happening there is it's an emotional coping technique. So when I feel bad about myself, what I can sometimes end up doing is comparing myself to someone who's beneath me. And when I compare myself to someone who's beneath me, I feel better about myself. So downward comparisons are essentially an emotional coping strategy. The problem with both of these things is that sometimes they can kind of get out of hand, right? If you actually look at the way that we make comparisons, that's not actually in effect what oftentimes happens. I can get stuck in this situation where I find myself comparing to other people who are better than me all the time. And sometimes that part of our brain, that circuit in our brain, can get hijacked and no longer be productive. The goal of an upward comparison is to try to figure out, okay, what can I do differently? But paradoxically, what can happen is as I compare myself to other people, instead of sort of creating a roadmap for progress, what it can actually do is destroy my motivation. I can look at other people and I can say, oh my God, like this person is so good at this stuff. Like there's no way I will ever be good at that. There's no way that I should even bother. I go to the gym once and everyone there is so ripped, like there's no chance. And so it actually has the opposite effect sometimes. The other thing that happens with downward comparisons is sometimes those can also get stuck in almost like a vicious cycle where the only way that I know how to feel good about myself is by making downward comparisons. So if I'm unhappy with some aspect of my life and I make a downward comparison as an emotional coping strategy, that can help me feel better emotionally in the moment, but it doesn't actually improve my situation at all, right? So what ends up happening, and we'll see this on the internet, we'll see people who are stuck at low ranks and constantly shit on people around them. And you'll kind of see this a lot where these are people who are criticizing and pretending to be better than everyone around them. But those people actually stay incredibly stuck in their own life. They don't actually make progress. So we know that there's sort of two kind of psychologically plausible reasons why we make comparisons. We know that, for example, they can be used as a roadmap for our own progress in the case of upward comparisons. And they can be used as an emotional coping strategy in the case of downward comparisons. The challenge is that both of these comparative models can actually get kind of out of our control. And in one case, what we can end up doing is making comparisons that don't actually give us a way forward. In fact, make us feel so inferior that they actually shatter our motivation. Or we can get sort of stuck in this cycle of using consistent downward comparisons, i.e. being arrogant on the internet. And then when we're arrogant on the internet, we don't actually improve our life in any way, shape, or form. So this is where, if we want to understand how to stop comparing, we have to understand a little bit about how these comparisons get made. So a lot of times, the struggle is that when we make a comparison, what we try to challenge is the comparison itself, right? We'll sort of like, I'm comparing myself to someone else, and I try to rationalize that maybe I shouldn't compare myself to this person, or this is an unfair comparison. Or if we reach out to friends of ours, they'll say, oh, your situation is different. It's really apples and oranges. But that doesn't really seem to work, right? So we know that sometimes if we try to tackle these comparisons, just something about it feels off. Something about it makes it like really, really hard to actually stop making the comparison. And if we really want to understand how to stop making comparisons, there's one other key thing that we need to look at. And that is the way our brain decides who to compare to. So let me put it to you this way. Do you compare yourself to elephants? Do you say, oh man, I'm so weak. Elephants are so much stronger than I am. Oh, that's sad. Like, I wish I was as strong as an elephant. Or do you ever feel superior to an ant? Right? Do you ever feel like, oh my God, I'm so awesome. I'm going to live so long. I'm so good at like playing FPS games. And this ant on the sidewalk, that ant sucks, man. I'm the best thing. I'm better than every single ant in the world when it comes to playing Overwatch. So obviously, like, no, right? We don't compare ourselves to like elephants and ants. We don't compare ourselves to dinosaurs. We also don't compare ourselves to a lot of other human beings, right? We don't oftentimes compare ourselves to, let's say, heads of state. Like I don't feel inferior to, let's say, the president of the United States or the head of state of a different country. So there's something weird about how our mind decides who to compare us to. And if we really want to dismantle the comparison, one of the things we can really understand is that process of how our mind decides who we compare ourselves to. So essentially what our brain does is kind of like puts us in a particular league. And what it does in terms of the comparisons it makes is it tries to compare us to people that we perceive in our league. So we may compare ourselves to schoolmates, for example, or people who are in the same grade. We may compare ourselves to siblings. We may compare ourselves to friends, right? So these are people that in some way my mind sort of says, me and this person belong in the same bucket. So it'll oftentimes, historically, it's been things like school, colleagues, family members, things like that. Oh, my older brother became a lawyer, so now I need to become a lawyer. My two older siblings both went to Harvard, so now I have to go to Harvard. The comparisons that we tend to make tend to be something related to us. Now, this has become a problem more recently if you kind of look at why is comparison growing so much and why is it so hard to deal with. And I think a lot of this actually has to do with the change in the way that we kind of utilize social media. So if you look at what social media does, is it takes what used to be a distant figure, right? So like it takes someone like, let's say, the president of the United States. And now using something like social media, we begin to see intimate parts of their lives, right? We begin to see like what they eat. I mean, I don't know if the president does this, but we get to see like, what they're eating for dinner, or like, what they're wearing that day, or in terms of like friends or content creators. We know that there's this parasocial relationship that's developing. Even friends of yours or people that you're connected to who may not even be friends, but people you're connected to on Twitter or Instagram or Facebook or whatever, we suddenly have access to people's lives in a way that we never have. And now that we have this increased level of access, what we tend to see is that people tend to make comparisons with people they've never met, right? Like you'll watch someone who makes like YouTube videos, and at the end of like watching their YouTube video, like a content creator, you'll start to feel bad about yourself. You'll start to feel like, oh my God, like why can't my life be like this? Why is this person's life like this? And I think this is really important to understand, but I think somehow social media has tricked our brain into thinking we're sort of in the same league with them. And this doesn't mean that we're not in the same league in an objective sense. What I mean is that as we start to see the inside of people's lives, our brain sort of like it checks some of the boxes for comparison. And then what ends up happening is once these people sort of enter our league for comparison, then what ends up happening is we start comparing ourselves to them. And then that becomes really, really unfair, because what's going on is we're only comparing ourselves not to their real life, but we start to compare ourselves to the version of the life that they show us, which is oftentimes very, very crafted, which ends up resulting in sort of this very unfair comparison that ends up, there's only one way that we can kind of handle this, or there's only one outcome from this, which is that we're always going to be inferior. And this is when we sort of see that, like, we can kind of see that there's like this upward comparison that our mind tries to make, which is normally used to help us kind of develop a roadmap forward. We can't really do that when it comes to a parasocial relationship with a content creator or someone who's like, big on social media, because there's no like real like A to Z, right? In terms of like becoming or achieving what some of these like large internet personalities have. So that's one of the things that I think has really changed, and one of the reasons that I think comparison has gotten a lot worse. Now, in terms of what to do about it, there are a couple of things that we can consider. The first is that anytime you make a comparison, start to ask yourself, why did my brain choose this person to make the comparison to? What is it about this person that makes me feel like this is a fair comparison? Because we've already said it's not fair for you to compare yourself to an elephant, right? It's not fair for you to compare yourself to an ant. So what is it that makes my brain think that this is a fair comparison? And as you tunnel down into that, you'll discover a lot of different things. Hopefully what you'll discover is that in a lot of ways, this actually isn't a fair comparison, or that the comparison that you're making is not complete in some way. So you may compare yourself to, let's say, a content creator or something like that, but then like you have to remember that content creators, I mean, this is their profession. They have staff, right? They have mods. They have a lot of people to support them. As you tunnel down into the fairness of the comparison that you make in terms of the selection of the person, what you'll discover is that hopefully there's something about that comparison that is a little bit unfair. And if you really think about it, we don't critically choose who to make comparisons with, right? Our mind automatically picks someone. And how does it make that determination? It's based on some kind of subconscious calculation. So as you tunnel down into like, okay, wait, why do I think that this person is even a fair comparison? You'll discover a couple of things. One is that you tend to not compare yourself one-to-one with one person. So you don't compare all of your attributes with all of another person's attributes. What you tend to do is you compare the best attribute of 5 different people with yourself. So what you're actually doing is not making a one-to-one comparison. You're comparing that person's relationship to your relationship, this other person's financial situation to your financial situation, this third person's physical fitness to your physical fitness, this fourth person's ability to cook with your ability to cook. And so as you make these kind of unfair comparisons, you end up feeling worse about yourself. And you end up sabotaging what upward comparisons are actually for, which is to develop a roadmap to move forward. The second thing to understand about comparisons, and if you really want to tackle them, we're going to actually take a step away from science for a second and go into yogic psychology. So what I really love about yogic psychology is that it tends to be focused on the individual. So one of the basic problems with science is that we can learn a scientific principle. Like we know that there are upward comparisons and downward comparisons. But the challenge is that knowing the scientific principle doesn't correct our behavior automatically, right? Like I can know that human beings do this. I can know that human beings use particular defense mechanisms. I can read about cognitive biases. But just because I understand the science of it or I study this stuff in a book doesn't mean that I myself change. What I like about the yogic system of psychology is that it's actually not based on objective truth and science. It's actually based on subjectivity. So it's all about kind of application within you. So the key principle that we're going to be talking about when it comes to yogic psychology is the ahamkar, or the ego. So the ego in the yogic model of the mind is something that makes comparisons. So if we think about our ego, it's our sense of self. And we can't really have a sense of self without a comparison to another person. And you may say, well, hold on a second, like how does that work? Like, of course I can have a sense of self outside of comparison to other people. Well, let's think about that, right? So if you view yourself as tall or you view yourself as short, you can't be tall or short without someone else being short or tall. If you view yourself as successful, that has to be in comparison to a failure. If you view yourself as a failure, that has to be in comparison to a success. So all of the attributes that we think about is our own identity. I'm a man, I'm a doctor, I'm a father, I'm a son. All of those things have a relational component, right? A doctor is one profession, but it's not all of these other professions. And if you're Indian like I am, or you're East Asian or South Asian, you will have found that there's a very clear comparison that gets made with a value judgment based on profession. I don't know if you all kind of feel this way, but a lot of times when I'm meeting people and they kind of ask me what I do for a living, one of the things I found is it's a shortcut for them to bucket me, right? When they ask me what I do, it's some way to bucket me into like how much respect they're going to give me for the rest of the conversation. So all of these attributes of the self or our identity are actually comparative in nature. And the ego or the ahamkar, one of the key aspects, one of the things that the part of the mind does is actually make comparisons. Now, how is that useful for us? The key thing to remember is that since the ahamkar or the ego is the part that makes the comparison, the more active our ego is, the more comparisons we're going to make. And if we go back to the upward comparisons and downward comparisons, we'll kind of see that, right? Because the more egotistical I am, the more downward comparisons I make, the more egotistical I am. And the more upward or unhealthy upward comparisons I make, once again, that's going to be a lot that has to do with ego. In this case, though, it'll be low self-worth, right? So when we make upward comparisons that make us feel bad about ourselves instead of using them productively, that all has to do with my self-esteem and my sense of self-worth. So the key thing here is that the yogis actually give us a very, very useful way to disarm the ahamkar or disable the ego. And the key thing about the ego is it's actually a defense mechanism. So the reason that we make, and this is based on yogic psychology, okay? So this is correlated by science, but y'all will see what I mean in a second. So the reason we make comparisons is actually to protect ourselves from negative emotion. Anytime our mind feels negative emotion, it actually activates the ego to protect us against it. And we sort of see this with the downward comparison, because if I'm feeling bad about myself, research into psychology shows us that we make downward comparisons as emotional coping strategies. And the yogis would say the same thing. So they'd say that if you want to stop making comparisons, what you actually need to do is forget about trying to make the comparison. What you need to focus on is your internal emotional state, and specifically your negative emotions. And there's a really, really good example of this. If you look at people who go through a breakup, one of the things that you'll find is that you feel really, really bad about yourself, right? And then sometimes you do something that's kind of weird, which is that you'll go and you'll stalk your ex's social media. And you'll see all the things that your ex is doing. And you'll see all of the potential mates that they're with, all of the potential partners they have. You'll see them out there having fun. And then what you'll do is you'll make 1,000 different comparisons with those people. And if you kind of think about it, like, why on earth are you doing this, right? There's something almost addictive about it, because when you start doing it, you feel worse about yourself, but you can't stop. And this actually has to do with the ego, because one of the key things about the ego is it's looking for conformity. It's looking for consistency. Oftentimes it's looking for justification. So if you're feeling bad about yourself, one of the things that your ego will actually do is go out and find some kind of information to confirm the way that you feel about yourself. It's almost incredibly validating if you stop and think about it, right? If I feel like a piece of crap and then I go look at my ex's social media and I see how they're out there having lots of fun, it reinforces the idea that I'm a piece of crap. It's actually incredibly validating, even though it's painful, which is exactly why we do it. So if you want to stop making these comparisons, what you really need to do is focus on that negative emotion and try to understand, okay, what can I do to process that negative emotion? What can I do to let go of that negative emotion? What can I do to accept that negative emotion? Because if I let the emotion activate my ego, then that'll change my behavior and cause me to make a lot of comparisons. So at the end of the day, comparisons are something that are oftentimes uncontrollable. We tend to find that we make them kind of very, very addictively. We tend to find that when we make comparisons, it tends to rob us of a lot of joy, right? So even when I make a success, when I do something well, a comparison can turn a success into a failure by comparing it to someone else. So if I get an A- on a test and someone else gets an A+, suddenly my achievement becomes a failure, which is really bizarre. And it turns out that people seem to be making more and more comparisons, and I think a big reason for that is social media. As we use a lot of social media, it sort of activates the part of our brains that allow our brains to make comparisons with these people. It tricks our brain into thinking, hey, this is a fair comparison for me to make. And as we start making these comparisons, what we tend to find is that they don't actually do what they're originally supposed to do. Upward comparisons were designed to give us a roadmap to improve our lives. Downward comparisons were actually designed to help us develop an emotional coping strategy that helps us in the short term. But as these comparisons get out of control, we tend to find that rather than spurring us forward, upward comparisons actually decrease our motivation and make us feel stuck. And downward comparisons can become sort of a vicious cycle of me comparing myself and feeling superior to lots of noobs on the internet, but not actually changing my life. If we want to disarm this, we have to understand a little bit about why our mind thinks that this is an appropriate comparison. And as we tunnel down, as we're critical of why our mind chooses this person, something cool will happen. We'll actually stop making the comparison. So as we kind of dismantle the justification that I deserve to be compared to this person, that we're in the same league. I'm not saying that you're better or worse. I'm just saying that at the end of the day, comparison really isn't appropriate almost really ever. And so as we sort of target, why do I think this is an appropriate comparison? It'll actually decrease the comparison. The second thing to remember is that comparison is a function of the ahamkara or the ego, and that the ahamkara and ego essentially activate when we experience negative emotion. So if we actually target the negative emotion that's fueling the comparison, that'll actually cause the comparison itself to lose steam. Because if you kind of think about it, when you're happy and content and chilling, you're not really making any comparisons at all, right? If you really stop and think about it, what you'll find is you make more comparisons when you yourself are feeling upset. So hopefully that's been a little bit helpful. I know that comparisons feel incredibly addictive nowadays. And I think part of the reason that they're kind of getting out of control is because we don't really understand where they come from, what they're designed to do, and specifically how they work. And if you can understand those things, hopefully you can start to overcome them. Questions? So no, comparisons are not always bad, right? So remember that all human beings make comparisons. And the reason that all human beings make comparisons is because they serve a purpose, right? Our brain is capable of making comparisons. The problem is that the original situation in which our brain's ability to make comparisons evolved is different from the world that we live in today. So I want you all to think about this. 50,000 years ago, how many people could you compare yourself to? And today, how many people can you compare yourself to? Our brain was not, our brain's capacity to compare was built given an assumption of a particular social circle. And essentially what the internet has done is blown our social circle through the roof, and our brain's capacity to make comparisons has been overloaded. We've lost control of it, which is why we're all screwed now. Y'all see that? So what triggers a comparison? Let's say there's like 5 variables that trigger a comparison. You have to meet criteria A, B, C, D, and E. So the number of people in your village who meet that criteria, let's say, are within 3 years of how old you are, right? Same gender as you, or any number of other things. And now, like, think about, so like that's what results in a comparison. And now think about if you know 1,000 people or 10,000 people, how easy is it to trigger that formula? Tons of people meet that criteria. So our access to more people has triggered so much more comparison. Can changing your environment improve the social comparison? Surrounding yourself with people who are less judgmental, don't have high expectations of you? It can absolutely help, but remember that you carry your comparisons with you, right? There's a point at which comparison almost becomes habitual. So you need to be really careful about that. Because even if you move to a group of people who are less judgmental, your mind is going to be like, oh my God, these people are so much less judgmental than I am. So be a little bit aware, but absolutely what we find is that a lot of comparison is conditioned. So essentially, comparisons that are performed out of negative emotions are usually not good. I think so. So sometimes our negative emotions drive our comparison. And if you kind of think about it, we're looking for confirmation, right? That's what our brain wants more than anything else. Our brain has evolved to generate patterns out of chaos. And so if I believe something about myself, the comparisons that I make will reinforce that belief. That's a fundamental part of the brain, which is responsible for so many things, not even comparisons, but echo chambers, cognitive biases, all that good stuff. So what we need to do is like understand what is driving our comparison. Be aware of our own negative emotion. And as we process the negative emotion, you'll discover that the comparisons actually plummet. Because I don't know how to say this like more simply, but just think about it. When do you compare yourself to people? Do you compare yourself to people when you're feeling happy and content? Of course not. Right? When you go to someone else's wedding and you walk in and you're awestruck by how beautiful their wedding is, and then you think, oh my God, this is so much nicer than my wedding. You make that comparison. You feel insecure. You feel inferior. And once that seed plants, then you'll start to notice all these other things. Their appetizers are better. Their music is better. Their decorations are better. They're prettier. And once that seed plants, then you're going to water it and water it and water it, and you'll make more and more and more comparisons. Reinforces the belief. The more you believe you're inferior to them, the more things you notice. Will create a filter for your mind, which will reinforce it, right? And then you get to the point where your comparison becomes a truth. It's true. I am not as good as this other person. Does that make sense? Late GG is saying, our emotional heuristics are challenging, especially from all that goddamn conditioning. Absolutely. Emotional heuristics is half of our problems. Okay. A heuristic is a tool that's used to enhance, or that's A tool that's developed for functional purposes but may not have a basis in reality. That's the best way I'd describe it. Be Skeptical said it even better. A shortcut. Basis in reality may not have been the right words, but a useful oversimplification is about it. Y'all did a great job at describing what a heuristic is. Can you stop all comparisons? Absolutely. So here's the question. So I Like Trains is asking, can you stop all comparisons? The answer is absolutely yes. You may be really confused by that. What do you mean you can stop all comparisons? So let me ask you a question. Have you lived a single minute in your life where you have not made a comparison? Yes. The answer is absolutely yes. Why can't you just do that again and again and again and again and again, right? Have you gone an hour without making a comparison? Absolutely. Have you gone 2 hours? Absolutely. Have you gone an entire day? Maybe, maybe not. Well, if you've gone 8 hours without a comparison, what did you do during those 8 hours? How do you duplicate that? But you can absolutely go through your life without making a single comparison. Right? So now people are memeing. They're like, the question was, can you? And the answer is absolutely yes. We didn't say it was easy. They just asked, can it be done? And the answer is yes. So Exokiller saying how to compare, be alone. Honestly, that's closer to the truth than people may give you credit for, to be honest. Because the key thing about stopping to make comparisons, because remember that comparison is a function of the ego or the ahamkar. And the ahamkar, by nature, when you're talking about a comparison, it requires an identity of you and an identity of the other person. When you are sort of completely alone within yourself, or you are completely connected, both of those can result in a lack of comparison. When you accept that you are just you, right? So it's kind of like if you look around, like no tree thinks, oh, I mean, we don't know, I suppose, but no tree thinks, oh, this tree is happier than I am, healthier than I am, taller than I am. It doesn't make comparisons. It is what it is. And rocks are the same way, right? And so once you realize that you are just what you are, making a comparison with someone else doesn't change anything about you. Do y'all get that? So if I'm 5'2" and someone else is 5'10", and I make a comparison, I say, oh, this person has it easier in life because they're 5'10". That can be completely true. We're not saying it isn't true. What I'm saying is that has nothing to do with you. The difficulty of your life is determined by your height, not by how easy their life is. The two are actually completely independent. I know it's kind of bizarre, but really stop and think about it. The fact that there are other people out there who are 5'10" and have it easier has nothing to do with your life. Your life is going to be as hard or easy it is based on your advantages or disadvantages. And the whole problem with comparison is that when we look at the advantages of others, we blind ourselves to the advantages that we ourselves have. So there's two really transcendent antidotes to comparison. One is to completely become independent of everything else around you and accept yourself fully as you are and not make a comparison with anything else around you, or to completely break down the barrier between yourself and others. Because it's the barrier that actually creates the possibility of comparison. Interesting question. Does that make sense? Could you use comparisons to motivate you in a healthy way? That's why they're designed. right? So comparisons in a healthy way are assessments of your capability and assessments of other people's capability, and then recognizing that you can duplicate their behavior to improve your own performance. That is a healthy comparison. But even if you tunnel down into that, there isn't a comparison of like personhood in that, right? That's kind of like saying a high rank player and a low rank player. I can look at the high rank player and recognize, okay, this person is higher rank. I should duplicate what they do. But you don't have to feel bad about being lower rank than the other human being. Do y'all get that? So you can make a comparison that can be useful, but actually the less ego that's involved in the comparison, the healthier it's going to be. So what if you compare them to only think I can do better than them, or do better than what you're doing right now? So is the goal to pew-pew the ahamkar? Is it something we should aim to minimize? Generally speaking, I'd say yes, but the goal is for you to be in control of the ahamkar, not for the ahamkar to be in control of you. That's the key thing. Is that the problem is that we don't control our mind. Our mind controls us. The mind isn't your enemy. The ahamkar isn't your enemy. It's kind of like saying, like, you know, if I have a dog that's not potty trained and is pooping all over the house, you could say, so is the goal to get rid of the dog? Like, that's one solution. But actually the ideal solution is to potty train the dog. Then you get all the advantages of having a dog without the downsides of having a dog. It's just, who's in control? Are you in control of the dog, or is the dog in control of you? How do we control our mind? Are we not our mind? No, we aren't. Okay, so let's do meditation for the day. Okay? So meditation for the day comes from the drowned man's question. How do we control our mind? Are we not our mind? The answer is no, we are not our mind. So you may be confused by that. So let me ask you a couple of questions. We're going to start this meditation with a few questions. Do you exist when your mind is inactive? That's kind of question number one, right? So do you exist, let's say, while you're asleep? Have you existed your entire life? Like, do you exist outside of mind? So some people are going to say yes, and some people are going to say no. So let's go through a couple of other things. So, who are you? Now this becomes the next question. How can we define who you are? All right, so let me ask you this. Are you now? The answer is going to be yes, I am me now. I'm certainly not you, I'm me, right? Clearly. Okay, good. So were you 1 year ago? Well, yeah, I mean, I was you, right? And then you may say, well, I wasn't the same me, I was a different me. Okay, fair enough, right? 1 year ago, you may have known less, you may have looked a little bit different, whatever. So 5 years ago, you were a different you. 10 years ago, you were a different you, but you were still you, right? We don't say that these are completely different people. There's a thread of you that runs through your life. That's how we know who you are. You have an identity, and I'm using that word loosely. You have a personhood, let's say, that connects all of the days and moments of your life, right? That's how we know who you are. You don't wake up one day and you're like, I'm Dr. K today, and we just swap places. Like, sure, there's the occasional movie about that, but there's a certain personhood that's you. Okay, so then the question becomes, all right, so if there is some part of you that is consistent throughout your life, what is that? Is it the mind? Let's start with that. Or let's start with this. Is it the body? So now, has your body changed over your life? So let's say when you were 3 years old, you were maybe 2.5 feet tall. And were you then? Yeah, you were you then. But now you're in a different body and you're taller. Does that mean that you're no longer you, or are you all different people? No, we're still me, but I'm kind of a different me. So we can sort of conclude very simply that even if the body changes, you're still you. If I get a haircut, I'm still me. Even if I lose a finger, I'm still me. If I have a kidney removed from my body to be transplanted into another human being, I'm still me. I can lose a chunk of my body and I'm still me. Right? Okay, so then we can conclude that to a certain degree, the body is not what I am. You can argue against that, which is fine. You're right. Then the question is, what about the mind? Well, does the mind change? Is the mind the same that it was when you were 3, when you were 10, when you were 15, the way you are today? Does the mind change from moment to moment? So when you say you are your mind, does that mean you are the thoughts that you're having right now? You are the emotions that you're having right now. And then you say, yes, that's what I am. But then if the emotions change, do you change? Well, no. Duh. I'm me. If I'm sad, I'm a happy me and I'm a sad me, but I'm still me. Right? So the mind fluctuates, and yet we remain who we are. So we're not the mind. So now the question becomes, well, hold on a second. Then what the hell am I? And now we'll show you. So sit up straight. Close your eyes. Back straight, head straight, neck straight. Now, the first thing that I want you to notice is a physical sensation. Pick any physical sensation. And now notice that the physical sensation changes. Maybe it's a little bit of discomfort with the way that you're sitting. Maybe it's an itch. And notice that the quality of the sensation changes. The intensity of the itch may change. The discomfort may increase. And now what I'm going to ask you to do is breathe. In and out slowly. But what we're going to do is pay attention to breath as change within you. Notice how the inhalation is different from the exhalation. There's no way to confuse the two. The sensation of a chest full of air and the sensation of a chest free of air are completely different. You may even notice an interplay, that the itch improves as you focus on your breathing. And as you focus on the itch, maybe the itch gets worse. But notice that in your body and in your experience, there's just all kinds of, there's a symphony of fluctuating sensations. The breath changes, the body changes moment to moment. And now look at 2 breaths. Pay attention to this breath. And pay attention to the next breath. Now notice that each breath is a little different. Maybe the temperature of the air has changed a little bit because there's a breeze going by. Maybe you've shifted position a little bit, so the sensation of your muscles opening up your lungs is a little bit different. that each breath is just a little bit unique. 99% the same, but 1% different. The smell that you have in this moment is a little bit different. And now we'll turn to the mind. Notice that you have thoughts in the mind. Maybe you have curiosity. Maybe you have discomfort. Maybe you have impatience. Maybe you're just paying attention. But notice that your mind changes. And now, I want you to pay attention to this subtle thread throughout all of these things. Whether you are focusing on your body, your breath, your thoughts, your emotions, there's one thing which is a thread that runs through all of these things, which is actually exactly the same, which is you. And the door to you is the capacity to notice. Notice that whether you are noticing your body, your breath, your thoughts, or your emotions, that is a constant. It's almost as if you're looking through a window into the world, and the world is full of thoughts and sensations and feelings and experiences. But there's someone who's looking through that window. You may not quite be able to see them, but just notice that you have the capacity for experience. That all things are felt by you. The feelings may change. The impact may change. The smell, the taste, the thoughts, the emotions, all of that change. But the one thing that has been common in your entire life is the experiencer. That when you were 5 years old and you had a birthday party, you were the one who was there. You experienced that birthday party. When you were 10 years old and you went on vacation, you were there. And even today, you were there. You are that which experiences. And just notice that. And as you solidify, sit within yourself. And then you'll begin to notice something else. That the itch that you have is not you. The hunger that you have is not you. The thoughts that you have are not you. They are of your body and of your mind. The emotions that you have are not you. The fears that you have are not you. The fear is within the mind, maybe within the body. But you can see it from the outside. You are the one who is looking. The hopes you have are not you. They're just hopes. So take another deep breath and ask yourself, why do I worry about these things? Notice that there are just patterns within the mind, ripples in a pool of water. Sometimes they persist for a long time. Sometimes they're large, sometimes they're small. But just like a pool of water, notice that all fluctuations of the mind are temporary. The happiness from your wedding day does not last a lifetime. The shame of being bullied at the age of 12 also does not last for a long time. Both may have echoes, both may have ripples. They'll fade with time. It is when we re-engage with those memories that we create more ripples. So sit now with yourself. And observe whatever stimuli come to you. If it's physical discomfort, be fully within it. If it's a thought, notice it. If it's a breath, observe it. Notice everything that you can about the breath. The temperature, how far it goes, the expansion of your chest. And whatsoever you choose, simply notice. Now go ahead and come on back. Okay. So people are saying, I'm nothingness, I'm zero. Someone's saying, I need a job. People are saying, I don't want to come back. Why did I pour tears? Nancy Drew is saying, thank you, I really needed this. Thank me for what? What did I do? I didn't do anything. You guys get that? I can't do anything. All I am is vibrations that come out of your headset or your speakers. Compressions of air that hit your eardrums. Thank yourself. People are saying that felt good and I feel funky. Yeah. That's good. Feel funky. See, funky is we don't have words to describe what I'm experiencing in this moment. So Cafe Bandito is saying, I don't get that. You did it. So next time, do it without me. Then who did it? Opinions on Sadhguru? I think he's got a lot to offer. Part of what I like about him is that he's not from a particular tradition, which I think is valuable in some ways. But, I think that, so remember that, like, all the teachers out there, right, whether we're talking about Sadhguru or Huberman or whoever, like, they're resources for you. So take what you can from each of them. Like, they're there to teach, and there to help. So take what you can from each of them. I want this to be more of a habit, meditating. So here's what I'll share with you. You start this as a practice, meditating. And if you do it for long enough, if you get good at it, then it will no longer be a practice. It will be a way of life. That'll be your default. Because if you really paid attention, you were just noticing what was already happening. So you can do that while doing the dishes. You can do that while doing homework. You can do that while taking a walk. You can live your entire life in that state of mind. And that's when the real fun starts. Alrighty. Let's see if I can log into... Oh no. I'm logged. Any mods around? I'm logged out of La Twitch. I was hoping to raid someone. So one thing that we wanted to share with you also, something pretty cool. We actually have a promotional code for coaching right now. If y'all are interested in signing up for coaching, we've got a Black Friday 1 promotion running that'll get you $30 off of your first month of coaching. So if y'all are interested in trying it, highly, highly recommend it. Coaching is really about having a coach help you figure out what you want from life and how to get it. So it's really about understanding yourself and leveraging that understanding to accomplish what goals you have. Sometimes it involves repackaging your goals because it turns out that some of the goals that you've been conditioned to have may not be the ones that you actually want to pursue. So check it out. I don't know where and when this is going to be uploaded to what. That's beyond my pay grade, chat. But I'm trying to... Okay, it seems like we don't have mods around, so I don't know how to raid. I'm going to try this for just 1 second. I'm not the CEO, Lucky. Kruti is the CEO. Okay, we're just going to have to... I can't raid, chat. I'm not logged in. I can't log in, chat. It's not again. It's the same problem. So yeah, I can stream. I'll try to log in before the next one, but y'all take care, everybody. We'll see y'all on Wednesday.